Hello, welcome to COTA SA. Welcome back to those of you that are joining us for our Let's Talk Aged Care webinar from last week's webinar, and welcome to new people that have joined us today as well. I'm Jermaine, I'm the Community Programs Manager here at COTA SA, and joining me again today is Trudy Gore, our Ageing Well Coordinator. Welcome back, Trudy. Thank you for taking the time out from your busy day. It's really great to be able to hear your expertise and share that with our audience today. For those of you that are familiar with Zoom, this is a webinar format, so we can't actually see you on the screen and you're not visible to any other participants, and your microphones are also muted. You can sit back, relax and enjoy the discussion while you have your lunch, and if you wish to ask a question, you can use the chat box function, which is at the bottom of your screen. There's something called chat. You can open that and you'll see that it's set to, you can type your questions in there and you'll see that it's set to that the questions will come to panelists and hosts only. So your questions aren't actually visible to other participants in the group. So feel free to use that function and type your question in, and we'll attempt to answer that as we go. Firstly, COTA SA acknowledges the Kaurna people of the Adelaide Plains as the traditional custodians of the land our headquarters occupy. We also acknowledge all Aboriginal nations throughout South Australia. We honour Aboriginal people's continuing connection to country and recognise that their sovereignty was never ceded. We pay our respects to elders past, present and emerging, and extend that respect to all Aboriginal people. Most of you joining us today will know that COTA SA, or Council on the Ageing SA, is a not-for-profit people's movement and the peak body that represents older people in South Australia, of which there are more than 630,000 in South Australia. So we work with governments and other decision makers to overcome disadvantage and equality, to showcase the diversity of ageing across SA, to challenge ageism and to create new possibilities for and with older South Australians. Our information, programs and services aim to help all South Australians age well. We encourage you to go to our website, our new website, to read more about the Rainbow Hub for LGBTI elders, the Fleurieu Neighbourhood Network for those living in the Victor Harbor and Gore region, the COTA Visitors Program that supports volunteers to visit with older people that are experiencing loneliness, a plugin that connects creators of products, services and policies with older people to inform and shape design and development. Our Strength for Life program, our very popular Strength for Life that builds fitness, strength and balance in over 100 gyms and facilities across the state. And our peer education programs that with older people are sharing quality information with groups of older people. And of course, Let's Talk Aged Care. Of course, these webinars are part of the Let's Talk Aged Care program. That's an initiative where any older person or a family member of an older person can contact us to get independent information and advice about aged care in easy to understand language that explains or breaks down the jargon or the acronyms that are commonly found in the aged care system. Our information and support is about finding and using services and supports that help you to live as safely and for as long as possible in your own home. Being independent, COTA SA being independent, our Let's Talk Aged Care team can give information and support that helps you to make your own informed choices with regards to finding aged care services and supports, and about choosing who will provide those services for you. So we've got up to about an hour today with you, and then again we've got two more webinars on the Wednesday the 25th of May and the 1st of June, and I'll be hosting each of those webinars, talking with COTA's Let's Talk Aged Care staff. We're recording these webinars as well, so we'll make them available to you after if you'd like it, and also to send to those that couldn't be available for this webinar today. Again, you won't be seen in the recording and neither will that chat box. and we'll attempt to answer all of your questions that you put into the chat box. We welcome any relevant questions, and I'll repeat your question as well before hopefully providing an answer, so that everyone can understand what we're talking about. If we can't answer any questions today, we will attempt to get back to you with some supporting information after the webinar. So we're delighted to be with you today and to share this information with you today, and I hope that it helps you to understand and access aged care supports for yourself or for your loved one. Last week, we started right at the beginning of aged care, and we looked really broadly at what aged care is in Australia. And we also then looked a bit closer at aged care services that are delivered in your home that help older people to stay living in their own home. And we looked into My Aged Care, which of course is the starting point to aged care information and services, and we looked a bit about registering with My Aged Care as well. So this week I'm glad to be joined to continue that conversation with Trudy, and we're going to dive a bit deeper into aged care that's delivered in your home, and we'll look at what happens after you've taken that first step of registering with My Aged Care, and we'll talk about the assessments, which is the next step, the different levels of care, how to find, or support I should say, how to find and choose aged care providers, and the steps to getting services started. So welcome again, Trudy, and let's talk aged care.
This is a big topic.
It is. So Trudy, like I said last time, we did talk about aged care that's provided to people in their own homes where they've lived, sometimes all their lives, or they certainly feel most comfortable. We looked at where to start accessing aged care, the My Aged Care website, and about calling the My Aged Care call centre for information or to register. So today I'd like to explore with you what happens, and I'm sure you can talk us through the assessment process, and then we'll look into getting services and supports in place. So to start, let's imagine that maybe I've registered with My Aged Care and I've talk to the call centre person for 20 or 30 minutes, and I've registered myself with My Aged Care. So I've given my personal details, I've answered their questions about what I can still do for myself, what I'm having some trouble with, and also the other family and other supports and things that I might have in place. I know that assessment happens next, but Trudy, if you could share with us what that means, what is the assessment and what's involved?
So when you, like you say, you've answered all of those questions and My Aged Care have done that screening, the screening centre will send off a request to the RAS assessor, which stands for Regional Assessment Service, and they will be in touch to have that assessment with you. If your needs from the very start have been determined as being quite high, you may be referred for an Acad team, and so a more comprehensive assessment. But generally, like 90% of the referrals go straight through to a RAS assessor, and they'll make contact with you to organise a time to come to your home. Generally, they're in the home. In this COVID environment, it may be that they do an over-the-phone assessment, and certainly if you're not wanting an assessor in your home, that's absolutely fine. You can request to have an assessment over the phone. And then it starts from there. If they do come to your home, the RAS assessor may ask you to show them how you do a few things in the home. And the idea behind that is so they can see if you're needing more supports by way of physical aids or extra physical supports installed in the home. So they might, for example, get you to get on and off the bed, and some people find that quite surprising, or in and out the shower cubicle even, because someone can talk to you and give you answers. But when someone sees how a person is in their own home, it gives them a better indication of support that they might need. Other things they'll do is to then sit with you and just ask general questions about how you're going with your shopping, with your cleaning, cooking, how you're going with your medication management, can you do that independently? And they'll also ask what existing supports that you may have. So a friend might be helping, a neighbour, your partner, your husband, whoever might be helping. And I always say, on top of that, it's also good to say whether or not that's sustainable, because you might say, yes, my daughter's helping, or my neighbour's helping. They might be helping after, for example, a stint in hospital or a period of ill health, and it might be short term. So a lot of people come to our aid in the first instance, for some people that support is sustainable over a period of time. But for some people, they say, thinking, well, I can only do this for a short term. And that's where My Aged Care can really, the services you can acquire through My Aged Care are really useful, because you can still call on your friends and family, and if they're happy to continue with that. But if they're not and you need more support, that's when the aged care system really kicks in and can support you with that. So if you have an Acad assessment, this, like I said before, means that it's been determined that you have higher needs. So you can start with the entry-level assessment, and that assessor may determine that your needs are higher than what's available through their program. So you may then be referred for an Acad assessment. And when that happens, it's not like you have to start at square one. They do get the notes from the RAS assessors, so they're building on those answers, but it's a comprehensive assessment, so there's more detail that goes into it. And so just within the scope of what we're talking about today and what Acad do, they assess for home care packages, so that's a higher level of care. And there are 4 levels, and they have different funding amounts that are assigned to those. And it's very different to the CHIS program, or the Commonwealth Home Support Program. As you can see on the screen there, we've touched on registering with My Aged Care, and then to the left it shows the RAS assessor and that process, and then on the right it talks about the aged care assessment team process. So in regards to an Acad assessment, it's funded differently to the Commonwealth Home Support Program. So anyone is eligible for both of those if they meet the criteria, but the Commonwealth Home Support Program is paid for partially by the consumer. They contribute a portion of the funding, and the government subsidises the rest. So, for example, full price cleaning might be $45, but through the government it might be that the consumer contributes, and this really is just a guide, it might be $15 to $20, and then the government puts in the rest. So that's the way the entry-level support is funded. But then with the Acad assessment and the services that come through a home care package, a person might be asked to contribute towards the cost of a home care package. And it is means tested. So what that means for some people is that they would need to contact Services Australia. And there is an aged care line with Services Australia. I don't know if anyone's got a pen handy, but I can just give that number now. It's 1800 227 475. That number again, 1800 227 475. And they will work with you to determine if you need to pay an income tested fee. And that's basically where it starts.
Sure. So I hope everyone can see that diagram. It's just a bit of a flow chart about after that first box there where you've registered with My Aged Care, then you get sort of one of 2 assessments. And in most cases, like Trudy said, it will be that first one that what's referred to as the Regional Assessment Service, or the RAS assessment, some people say. And Trudy also talked about the Acad assessment, which is for those higher levels of care shown on that diagram. Thanks, Trudy. All right, so if I'm now going to have my assessment, how can I prepare myself, or how can I make sure that my assessment, I get, a good outcome from my assessment? How can I prepare?
So thinking about what supports you might need, and you might be asked, well, what would you like? But that is very broad. So to prepare before is really useful. And, you think about things like how are the household chores going, for example. If you're finding you're having trouble bending down and cleaning the shower cubicle or mopping the floors, and that's taking a lot of time, or cleaning the windows. I met with someone recently who said it used to take them a day to clean all of their windows. Now it's taking them a week. So, if you're cleaning your windows and it's taking a whole week, there's not much time left for anything else. So if you're happy to clean your windows for the week, that's absolutely fine. No one's going to take that away. But it's more to the point that if your life's a bit out of balance, that you're not doing the fun social things you like, or, just whatever you're choosing to do, and you're spending more time doing household chores. So more things that you can consider, whether or not you're able to drive to appointments. So some people are quite confident driving locally, and some people may have felt confident once upon a time driving to the city, for example, for appointments. But if that's just proving to be a bit challenging, transport is something that can also be provided through this program. How are you looking after yourself, like your personal hygiene? Are you able to get in and out the shower safely? Are you able to dress yourself? There's a huge range, but think about what's specific to you when you meet with the assessor. And don't worry if you don't cover off everything. When they meet with you, they'll ask a lot of questions that will prompt you to think about things you may not have considered before. And like I mentioned before, just with your family, if they are helping or anyone, is that sustainable, and can services help fill that gap? So you'll be assessed as an individual. It's a holistic assessment. So someone down the road might have a home care package, or they might have this service or whatever, but that might not be relevant to you. Yes. So you need to be assessed on your needs, not compare yourself with what other people have got. But certainly if your needs change and you are needing more support, it's another phone call back to My Aged Care, and they can reassess to see if you are needing more support. So have some good notes and questions prepared, and ask for clarification, because I find that because this is like a new language, that there's a lot of jargon like we've discussed, and a lot of information that you're given, and do seek clarification, because once they're gone, it's harder to get hold of them. Make sure that you're understanding what's being revealed, and ask any questions just to clarify. And you can also have someone with you, which I find is really useful, because then when the assessor goes, the two of you can put your heads together and just go over the information that was provided.
And write down those outcomes and so on.
Yeah.
Is there an element of safety as well, Trudy? Like you mentioned about, taking a week to clean the windows, or, if I had to get on a ladder and to clean my windows, I might feel unsafe and I might feel like I'm going to fall off the ladder and hurt myself. Is that a consideration as well? That's
a big consideration, because it depends. Like all of these services are provided based on that safety and level of care, because for some people they're paying for a private gutter cleaner and they don't need that taken away. But for someone who is doing their own gutter cleaning and they're struggling with that, and it is a safety issue, and they want to keep their house maintained, by all means, staying safe is a really big, important part of that. And if your goal is to stay safe, but also have your house well maintained, certainly raise that with an assessor.
Sure, thank you. All right, so let's say, Trudy, that I had an assessment at my home because I talked to My Aged Care. Let's use a bit of a scenario. I talked to My Aged Care, I registered, and I had an assessment at my home because I, for instance, can't get to specialist appointments, like you mentioned, as I now have maybe I have a locally restricted driver's licence, and let's say I can no longer reach up to hang the washing up, or I can't get some food out of the freezer, for instance. So let's imagine the RAS assessor or Regional Assessment Service assessor gave me some codes for transport assistance and domestic assistance. What's the next step from there? What's the next step?
After a RAS assessment, they will leave a support plan summary in the home. So they will outline what they've discussed with you and what supports and services you may need. So if you've been assessed for services, like I said, that will be documented, but there are two scenarios. So the assessor may be sitting there with you, they might have their laptop open, and they use what's called a portal. So it's access that anyone who's aligned with My Aged Care has access to, and they can see in real time like who has availability for the services that they've referred a person for, or wanting to refer a person. So they might send off that referral, which means if there's availability, it might have gone to two providers, and they'll say to you, the assessor will say to you, I've sent the referral off to these two organisations, is that okay with you? It's always about the choice of the person who's being assessed. And so with consent, those referrals are sent off. Those organisations that the screening those referrals just to see, you know, what comes in, and they'll see that 2 have come in from this person. So one organisation may take that off the portal, then ring the person and let them know, look, we've received your referral, we can provide, for example, cleaning, and they will talk about their costs and the arrangement to set up that service. At any point along the way, if a person's not wanting that, if they've changed their mind or whatever, there's no obligation to have it. So it's not like once you had the assessment, it's like, oh dear, I'm on this, I'm just on this trajectory where I might have something I don't feel comfortable with. You know, gaining more information about the service and the cost, and at any point you can decline the service if you want to.
So you're not locked in.
You're not locked in.
Yeah.
So that's one way. And like I said, they will call you. But if you don't hear back from a provider, and the assessor has said, look, we've sent off that referral, but you don't hear back from them, the assessor's long gone, it's a call back to My Aged Care. Because My Aged Care have the back end, of, like I say, of the computer system, and they'll see that, oh yes, I can see that that was sent to so-and-so, that organisation, that provider, and it hasn't been picked up. And then they can help you from there. So another way at the assessment process is that an assessor may leave a referral code, which means that the person who's been assessed can find their own provider. How do you go about that? There is a Find a Provider tool on the My Aged Care website that a person can look at. It's not always current, it's not always kept up to date, which can be incredibly frustrating. So I generally suggest to people that they ring My Aged Care, because My Aged Care have access to the portal. They can tell the person who has availability for the service that code has been provided, and then the person's given the number, rings them up and can get that service put in place.
And if I don't feel confident to do that, Trudy, then I would be asking the assessor to please send off referral so an organisation contacts me instead. So
it can go either way. Yeah.
Okay, great, thank you. And what if I'm having trouble finding, or what if I don't hear from an organisation, or what if I have the codes and I'm looking and I can't find an organisation that has availability? We know that's an issue across the board, and we hear that a lot. So what can people do?
Yeah, it's really hard at the moment, and you know, with COVID and the workforce, there's a lot of reasons why there aren't the immediate availability for services that people require. But I suppose a person can consider alternatives, like if family can help out short term. It's not to say that you wouldn't go back and relook at getting services through this program, but in the interim, it might be that once said that you have help from family or neighbours. Can a family member provide some meals short term, or buying frozen meals is something I've seen people do as well. They feel comfortable with that. Is there a different way of doing things? For example, you know, instead of going to the doctors, could you have like a telehealth appointment and do online shopping, that sort of thing? And there are aids, different equipment that you can use in the home. There's a stick vacuum cleaner rather than a barrel vacuum cleaner and pulling that behind you. You know, even with the shower, there's extension arms that you can put cleaning equipment on and whatever. So there's a range of aids that help people in the home just to make a few tasks that bit easier.
Oh yeah, good to think outside of the square, I think, isn't it?
Yeah, definitely. Especially, like I said, that, you know, it's a difficult time to find the services that you need straight away. But always ring My Aged Care again and see if there's any availability for those services.
Okay. And I was just thinking back to that scenario, if I couldn't hang the washing on the line anymore, then I might buy a large sort of clothes horse or one of those lower sort of washing lines, so I can hang my washing at a lower level. Yeah, good idea. Good idea. Okay, so we've talked a bit about that RAS assessment, or that assessment for lower level services or services that come under the Commonwealth Home Support Program. Let's go a different way or the other way. And what if I'd had an Acad assessment because My Aged Care determined that, you know, I had some higher needs and I was now eligible for a home care package? What should I expect to happen after I've had an Acad assessment?
So after an Acad assessment, you'll receive a letter and it will talk about the outcome of your assessment. And the letter will say you have been approved. So if you have been approved for a home care package, the letter will have the wording approved in there. but like I said, it will give a general overview. You may not have been approved for a package, but it's an outcome letter. And if you have been approved for a package, there is a wait list, and the time depends on how you've been prioritised by the Acad assessor. You might be a low, medium or high priority, and there are certain wait times for each level of the home care package. To find out the wait time, you can go onto the My Aged Care website, or you can ring My Aged Care and they can tell you. So, you know, you can ring as often as you want. Like I tell people, it's a huge call centre. It's, you know, that's what they're there for, to answer your questions and to help you. So, you know, you do progress through that queue, and that wait time does go down. And once that wait time has changed and it's closer to the time when you actually are eligible for that home care package, you will receive, it's about a 3-month letter just to notify you that you've progressed in the queue, and you might want to start looking around and getting some information from providers. And then when you have been you've progressed through the queue, you'll be assigned, you'll be sent a letter that says you've been assigned, and that's a critical wording. So approved and assigned are pretty similar, I reckon. And so to say you've been assigned is when you can go in earnest to find that provider and get that process set up with a home care package. So you'll have some time to research providers and choose who you want to go with.
All right. So, all right, let's imagine we're at that point then. We'll have a look now at the My Aged Care website the service finder tool to see how we might actually find a service provider, and Trudy will talk us through a little bit of the service finder tool. Sorry, the finder provider tool. Better use the right language. Yes.
There. Provider.
So we've got a few options there, don't we, when we click through? Find a provider that's right for you.
Yeah, so where are you looking? So we're going to use Door Park as an example today. So you put your postcode in there, and then the care type required. So as an example, we're going to use home care package. So you just toggle down to home care package, and then after that, you just need to click on done. The services that you're requiring, I said a level 3 home care package we're going to use today.
And we would know that detail from our letter of assignment,
letter, that would be on there, yes. And if you click on the more box, click with availability. Otherwise, you get everyone in South Australia in your area, but they might not have availability. So then click on done and then search. Okay, so it's come up with 51 results. So that's a lot of organisations that are saying they have availability. So there are some are for specific communities, like Aboriginal community services, some names you may have heard of before, some maybe aren't familiar, some certain nationalities. So Trudy, at this point, I would just scroll through and have a look at those. So you might want to, you can compare as many as you like, but you might say, oh, I've heard of Calvary because I've heard of Calvary Hospital. That might be your only connection. Or you might say, I've heard of Calvary because a friend uses their services. So it's just a matter of picking a few. So I will just click on few. So there's another one, ECH. So you're just randomly picking some? When we do this, we don't make recommendations because it's really hard. Everyone's experience is very different. So it's up to people to make an informed decision, and certainly that's what we aim to give people is information, but we can't make recommendations. So what you've done there is clicked on compare. Compare. So the top right-hand corner was compare home care package providers, and they're the 3 that I chose. And then I scroll down and it says choose. So you actually have to put them in the boxes there, the ones that you clicked on. So the details that we have there are those 3 organisations that I clicked on. And it just gives a little bit of general information about the contact details, their hours of operation, and the quality of their care. So nothing comes up as being a current or past sanction. And then it talks about the levels of package. They all offer levels 1 through to 4. Now here, even though I did tick the level 3 box before I went in, when I was looking for providers, I need to change that here as well. Show values for a level 3, otherwise I'll get information related to a funding level that's different to what I'm looking for. So they talk about care management. So that's the cost to manage your care, and then package management is there.
Quite complex, isn't it?
There's a lot of information, but I suppose what they do here, and you can't see the top of the screen as well, so you have to go back and say, which one was that with? So, for example, say...
Oh, I see.
Yeah, so ECH, it's saying there care management is 48% higher, so you can click on this, higher than average. So the average provider is $203, and it's saying ECH for that level 3 package is higher than average by 48%. Out of that.
So there's some nice comparison sort of tools there.
And there's this fee as well. It's called the home basic daily fee. So it's part of the home care package amount. And you'll notice these two organisations have a 0, and this one, which was, we'll go back, Awandor, they are charging $153. So that may be a deterrent because that's a significant amount of money, but that is paid for by an individual. But what you can do is ask for that to be fee waived. So it does say in the government guidelines you may be asked to pay that. If cost is a consideration, a person can ask if it's able to be fee waived. So if there's just for example, Awandor, there's everything that you like about them, but you're thinking, well, that's a bit of a deterrent, you can ask them if they're able to fee waiver that. And based on their answer, that might help you make the decision as to whether or not you choose to go with them. Further down, prices for their services and just a few specialisations. And that is the basic way of doing it. And then you can clear all of them and go back and choose some more providers there. Okay.
So in that tool, Trudy, I could compare 3, but of course we had 50 to choose from there. So I guess, is it about working out what's important to me? Like we looked at some of the costs and fees there. What else can I think about in comparing the providers?
So the basic daily fee is one thing. It's also, does an organisation charge an exit fee? So some do and some don't. So that might be something a person wants to ask. And just to remind people that the exit fee is not paid for. The exit fee isn't paid for from your own pocket. It's paid for from the home care package. So if you were to go to another provider, you wouldn't be paying that from your own pocket or contributing. You would be that would come from the home care package. So another thing is it's called brokerage fees. So some of the organisations are smaller and they don't provide all of the service a person may require, and you might need to pay for those privately, so to speak. If you get a receipt, it's given to the organisation and they pay for it from the home care package as long as that's been approved prior to the purchase. And that's called a brokerage fee when the organisation has to process an external invoice. So some charge 1%, some charge 10%. So that might be something you want to ask, what's the brokerage fee for processing invoices? You might want to know about the continuity of workers. So I've heard people say that they've had a different cleaner every time the person comes to their house, which they find, some people find frustrating because they say, I've got to train the cleaner every time, so tell them where the PowerPoints are. But for some people, that's not a problem. So it really does depend on what your personal requirements are. Other organisations give windows of time for home visits. So they're a bit like the old washing machine repairer person. I'll be there between 9 and 12, and you might be spending a lot of time waiting. But, if you're at home anyway on a Tuesday and that's when they come, that might be fine with you. But some people like to know that they're going to have a visit at 9 o'clock, for example. Another thing is, I suppose it's about discretion, how discreet a company is in regards to their presence. Like, I think we've all seen those cars that are badged with the organisation's name on the side. and that will be sitting out the front of your
Or
house.
uniforms,
Or
maybe.
uniforms as well, yeah. And, you know, for example, if you're receiving support with going shopping, that person might be wearing a uniform and a name badge. Some people, that's not a problem, but some people might want something a bit more subdued. It really is personal preference. And there are specialisations, you know, we mentioned what we saw on the website there with language and culture or whatever. You know, there are organisations, for example, that provide services for Greek services, Italian, for Aboriginal people. So there is a huge range of things that you can look out for.
So what you're saying, Trudy, is then it's a lot more than just comparing the fees and the availability. It's more about it also includes what's important to me, and I've got to work out what's important to me. And is it that continuity of people coming into my home, or am I more concerned with the costs and fees? And that's the way to sort of compare the providers, I guess.
Yes, definitely. And I think, you know, there is this, just from my experience of looking at the charges, the fees that organisations charge, there are some that are quite a lot cheaper, there are some that are quite a lot more expensive, and then there's this band in the middle where there's this mid-range of providers. So I suppose if I wanted to go with someone who was an organisation that was charging a higher percentage in fees, I'd want to know why. Like, am I going to get better care? You know, you might not want to discount those organisations. There may be something in there that you may think, yeah, well, I would like that level of service that they're saying I will be paying for. Or you may be wanting more hours of service, in which case you would want lower fees. So it really does depend on what's important to the individual.
Absolutely. And I guess being able to compare 3 providers on the My Aged Care website, if I wanted to look at more than that, I could sort of write down my own criteria about what's important to me, and then compare that way as well. And
I was just going to say, there are a few avenues for finding information on providers. Like there is the DPS guide, which is a publication there that's available online, or as a hard copy. It's called Aged Care Guide to South Australia and Northern Territory. So there's lots of provider details in there. If you can't access information online, once again, you can ring My Aged Care, and I've heard people say that they've contacted them and they've sent a list of providers.
Oh, fantastic.
So it's always good if there's something you think, well, I can't get on a computer, or we have mentioned in the last episode getting to the library and, you know, getting on the computer at the library. But, you know, you can ring My Aged Care and they will send out some information as well.
Sounds like we need this number on our speed dial, don't we? Okay. All right. So, Trudy, now the next step, if I've narrowed that down and I've looked at those 50 providers and I've worked out what's important to me, and I've done my comparisons, and I've narrowed it down to, say, 2 or 3 providers, what should I do next?
I would be asking if they can come to the home.
So I'm contacting them and calling them?
So giving them a call and asking them if they will come to the home or provide some information. At this point in time, once again, some organisations are doing home visits, some aren't. But I think what's really important is to be provided with a sample budget and a contract, just a blank contract for you to get an idea of what you're locking into. They're fairly generic, but there might be some things that are specific to those organisations, and you know, you might just want to check out. You might not want 53 of those contracts. You might just want a few of them just to compare. But meeting with someone is good if they're able to offer that. And the sample budget is really useful because it will outline, based on what you've told them, the provider, what you might need. So we'll just go with something quite generic, which would be, for example, a cleaning service, some transport and some meal service. And they'll be able to advise you whether or not they can take on that home care package, because they have to look at their staff, their level of staffing, as to whether or not they can meet a person's needs. And with a budget, they will write out what the cost of that is, and then you'll be able to compare those 3 budgets, and that's a really good place to start.
Okay, great, thank you. Okay, great. I think we've got a question here. I'll just check the chat box. Okay, so Jean has said that she's contacted a number of providers and they had services showing on the My Aged Care website, but when she contacted them, they said, no, we don't have availability. What can we do about that?
That's what I mentioned before. It's On the My Aged Care website, that's kept up to date by the providers themselves, and they don't always keep it up to date. So, like Jean's done, you might contact them and they haven't got any availability. That's when I would be calling My Aged Care. As I mentioned before, they have the My Aged Care portal, that back end of the My Aged Care system, and they can see if there are any providers with availability.
Okay, great. I think I remember looking at a provider, and if you scroll right to the bottom of their information, when you click into a provider to read more about them, it's actually got an updated date at the bottom. A bit of a disclaimer that says it's the responsibility of the provider to update that information, like you said, but it's also got the date they last actually did that. So that can give us an idea about whether that's current information or not.
That's a good idea,
All right. If anyone else wants to ask questions, please feel free to type those into the chat box. We're happy to take questions. Okay, so so there's a lot to it, Trudy, isn't there? There's a lot to sort of think about, and it's about thinking about my preferences and what I would like from that. And we've got a question here from Jane as well. When will the RAS and Acad merge into the one assessment, assuming that eventually CHSP will stop and packages will then be provided? Very good question.
So that's happening next year. So July next year. It should be simplified. That's the aim of this, because at the moment, the RAS, CHIS, home care packages, Acad, the different levels of funding, it's very confusing. Even before you've received a service, trying to understand what's involved in the whole system. So next year that will happen, and it will be very different to how it is now. A person will be assessed just based on their needs, and there won't be that differentiation between lower level, high level. It will hopefully make things so much easier for people.
Yes, and that's certainly the recommendation from the Royal Commission, wasn't it, to make those things easier. We at COTA SA are trying to keep on top of those changes as they happen, and we will try and share that information as that is determined. We know that the new program, or the CHSP, that Commonwealth Home Support Program, and the home care packages will combine into one called Support at Home. How that looks within that, we don't know yet. So as we learn that, we'll share that and with people as we go. And certainly when the RAS and the Acad, using those awful acronyms again, when that combines to be one assessment service, we'll be sharing that sort of information with people as we learn about it as well. Just got another question there as well from Tina, that fees take up most of the package. And how can we get the fees down? And we touched on that earlier, Trudy.
Yeah, so there are a couple of things a person can consider. You might want to change providers. You might want to go with someone else that offers a cheaper percentage of fees, and start that process again, finding a provider, speaking with them and changing providers. Or the other thing you can do is self-manage. That I believe we're going to touch on in webinar number 4.
Yes.
So self-management isn't for everyone. I'll just go into it really briefly, but it's not for everyone, and there are resources that a person can look at to see if self-management is for them. But obviously when self-managing happens, there's a lot less money taken up and spending on fees.
But again, it's weighing up what's important to you, isn't it?
Yeah.
And whether it's, you don't mind paying a bit more to get that perhaps good coordination or whatever, or if you really want to get those fees down, then you can sacrifice and do some self-management and that sort of thing if that's your thing, and if you can manage that, I guess. Yeah. Again, it's your choice.
Yes.
All right. Okay, there's one more question from Donald. The council used to do a yearly gutter clean, but said they won't do it anymore. We hear that a bit, don't we?
We do. Certain providers seem to have spent their budget by January, and they're not doing anything from January to the next financial year.
And I'll just clarify, that's likely to be in the Commonwealth Home Support Program area, isn't it? Not regarding home care packages.
That's definitely the case. So that really a person their option is to wait if they want to stay with that same provider. If they've been told that more funding is coming, for example, in the start of the next financial year, the person may choose to wait and receive the service then, or they may pay privately for a service, or they can go with another provider, which is bit of a process, but a person can ask for, we mentioned earlier on, services are provided with referral codes. So you can't have two providers. It's a bit like having a prescription and going to one chemist. You can't go to another one without that prescription. It can only be used with one provider in this case. So it would be asking for that code to be revoked and going with another provider. And that's a process My Aged Care would be able to help a person with if they were wanting to change providers.
But then I'd sort of lose my spot in the queue with that original provider, wouldn't I?
Well, that's a choice you'd have to make, because you do run the risk. If you're happy, if you have been happy with the service, but it is just a matter of waiting, I suppose you have to toss up whether or not you're going to stay with them or go with a different provider who has availability.
Or if there's some urgency with cleaning the gutter, maybe it is going for a private service, or asking family or friends to help you with that, or to even do it for you or something. Yeah. Good question, Donald. Thank you. All right. Let's have a look. We've got no other questions. All right. If anyone else has got a question, please do pop it in that chat box and we can answer it for you. But yeah, thank you, Trudy. Thanks for sharing that. It's definitely a complex system, and especially understanding whether you're sitting within that Commonwealth Home Support Program area or whether you're in that home care package area. And I believe there's also, if you are on the waiting list for a home care package, sometimes you can actually access CHSP services while you're waiting. Is that right, Trudy?
That's right. An Acad assessor may put in a number of CHISP referral codes. Once again, you might get a letter with 9 codes, and it's that process we spoke about with the CHISP services, the Commonwealth Home Support Program services, is finding a provider who can deliver those services while you're waiting for a home care package.
But it is important to remember, though, that there is some limited availability to what's actually available out there. As much as we say, yes, you can get those services, the reality is at times that providers just don't have that availability. So we do need to keep that in mind, and maybe, like we talked a bit about before, think outside the box and think about where I can get services and supports outside, whether it's paying for a private service or leaning on family and friends and neighbours, or perhaps the young lad down the road might like $20 or something to do the garden or something. Who knows? You've got to sort of think about how you can get your needs met if those services aren't available. All right. Well, thank you so much for that, Trudy. And thank you, everyone, for joining us today. I hope you all gained a better understanding of those next steps about finding aged care services that suit you. We know it's a challenge, and it's definitely an area that COTA SA, and I'm sure older people would like to see improve with those changes that are coming in aged care. And we've got a federal election coming up. Now's a good time to pressure your local member about aged care, and ask your local member what are their policies about aged care, and how are they going to improve aged care for you and help you live longer in your home. And now's a really good time to do that. So again, if you'd like more information and tips about navigating this part of aged care, finding a service provider in a very sort of complex area, think about the alternatives, think about the urgency of your needs and what's important to you. You can contact COTA SA for some navigation support. We have a bit of a waiting time for that service even, because that's popular as well. But we can send you a copy of this webinar if that's useful for you. And you're most welcome to contact COTA SA for any further questions, or if you want more aged care information and support. And of course, we'd urge you to go to our website, which is cotasa.org.au. That's cotasa.org.au. Our Let's Talk Aged Care page has some videos and some information about aged care and some links as well. The My Aged Care website, of course, is an absolute wealth of information. If you haven't been there before, we'd encourage you to just jump onto that website and have a play around. Use that find a provider tool, put in your postcode, change your preferences and so on, and use that find a provider tool in My Aged Care. And of course, that number that we're all going to save into our speed dial, the free call number for My Aged Care, we'd encourage you to give them a buzz as well to find more information. We've got some copies of that DPS guide for those that aren't online. If you'd like one of those, you can collect one of those at our office as well in Hutt Street. So thank you again. There's no webinar for next week, but the following week on Wednesday, the 25th of May, our next webinar will be especially for people living in the country. So we'll look at aged care in the country and what the unique sort of issues and services that are available in the country. We'll be talking with John Moran. John Moran is our Ageing Well Coordinator specifically for country regions, so we'll look forward to talking to him. If you've registered for that one, that's great. We'll see you then, and you'll receive that new meeting link by email, and you can join us then. If you haven't registered but you'd like to, or you know someone living in the country that would benefit from joining that one, you can register again through our website under the events page. You can click and find the link there to register through Eventbrite. Thank you again. Thanks everyone for joining us over your lunch. Bye for now. Thank you. Thanks, Trudy.
Thanks, Joanne.